Welcome to the Sleep and Dreams 6 o'clock news. I'm Kennedy Kidd, keeping you informed on the latest happenings in the sleep world. Today's topic of conversation is the sleep cycle, common sleep disorders, misconceptions about sleep, and sleep debt. Here are the headlines. Your sleep cycle is the oscillation between two different states of sleep, your REM, rapid eye movement sleep, and your non-REM or slow wave sleep. REM sleep is dreaming when the brain is very active. The rest of your sleep, 75% of your total sleep time, is non-REM sleep. They cycle through the night in periods of about 90 minutes. The brain is never inactive and never turns off. It idles in non-REM sleep. In REM sleep, the brain creates a world without any sensory input. So if you find yourself dreaming about the day's news, you'll know you're in REM stage of sleep. Your internal circadian clock, or circadian rhythm, is an internal near 24-hour rhythm that persists in constant conditions. It is programmed to have you asleep at night and awake during the day. These cycles are ubiquitous, existing in everything from mold to algae to insects, and yes, you too. For us humans, it exists in the hypothalamus. You may ask, what purpose does this cycle serve? This rhythm allows you to organize all things at 4 cell, tissue, organ, and system psychological levels. It affects your sleep, hormone secretion, temperature regulation, cognitive function, metabolism, and muscle performance. It allows for internal coordination between the heart, glands above the kidney, and glands above the liver to predict the time you wake up. This way, if you wake up at 6 o'clock to watch the Sleep and Dreams 6 o'clock news, your body will start doing this process earlier. So by the time you wake up and try and get out of bed, you won't fate trying to reach your morning coffee. I will now pass it off to reporter Alexa, who will give you more information on common sleep disorders and how to treat them.
Thanks, Kennedy. Tonight, I come to you live with results from a survey highlighting the most common sleep disorders from our S&D viewers. The top 3 were insomnia, sleep apnea, and restless leg syndrome. It's no surprise to find out that insomnia was the most common sleep disorder amongst our viewers. Although it's formally a symptom that can become a syndrome, insomnia is characterized by having trouble falling asleep or staying asleep, which then results in daytime impairment the following day. 1 out of 4 adults complain about insomnia, but it's estimated that only 12 to 15% of people actually suffer from chronic insomnia. While there are basic sleep habits that may improve sleep for the average person, these changes tend to not work for someone with chronic insomnia. Instead, cognitive behavioral therapy should be the main treatment method used. Some examples of this type of treatment include getting rid of the negative association between the bedroom and poor sleep, making sure the time in bed matches the total sleep time, and eliminating the anxiety that comes along with not being able to sleep. Our second most common complaint from our viewers was sleep apnea. Obstructive sleep apnea is characterized by a blockage in the throat that then causes pauses or difficulty in breathing during sleep. It's estimated that about 25 million people in the US suffer from sleep apnea, although it is much more common among adults between the ages of 30 and 70. There are a wide variety of treatments that include both conservative and invasive options, but the most common options are lifestyle changes, the CPAP machine, and oral appliances. If these main options fail, then many patients are forced to turn to surgery. Lastly, although less talked about in the mainstream, restless leg syndrome was another common sleep disorder for Channel 7 viewers. This syndrome is characterized by having the unpleasant and uncomfortable urge to move one's legs, most commonly occurring in the late afternoon, evening, and night when an individual is lying in bed. In addition to being extremely uncomfortable, restless leg syndrome can also make it difficult to fall asleep and result in daytime sleepiness the following day. With 7 to 10% of the population dealing with it, many individuals seek out treatment options for restless leg syndrome. Sometimes RLS is caused by another underlying condition, such as iron deficiency, peripheral neuropathy, and diabetes. And thus, one treatment option is to treat the other underlying conditions. Some other treatment options include lifestyle changes like limiting alcohol and tobacco use, exercising regularly, and maintaining a regular sleep pattern. In severe cases, medications that target calcium channels and those that increase dopamine levels in the brain can also be used. Reporting to you live, this is Alexa White.
And breaking news coming in tonight. Rumors of the acclaimed Stanford course Dement Sleep and Dreams being discontinued has sparked student protests on the university's campus. Sleep and Dreams news reporter Acassia Ferguson joins us now live from Stanford's campus. Cassia, what else can you tell us about this?
Well, Kennedy, I'm right here live on campus because the Faculty Senate convened last night to discuss changes to the courses being offered for the 2021-2022 school year. Our channel has confirmed exclusively that Dement Sleep and Dreams is, in fact, one of the courses facing the chopping block. Audio leaked by a disgruntled Senate member reveals that another member stated in the meeting, and I quote, "If students are concerned about their sleep patterns, they should take sedatives. A course about sleep is not imperative." End quote. A significant number of students, many of whom have formally taken Sleep and Dreams, have descended onto White Plaza behind me to protest the Senate's decision to remove the course from the school's curriculum. They're here trying to clear up misconceptions about sleep and are stressing the importance of having a class where students can learn about the many factors that affect sleep quality. Earlier, Stanford senior Rebecca Simon gave a moving speech that our news channel will recount here. She expressed that before taking Sleep and Dreams, she believed many misconceptions about sleep. Before taking the class, she thought sedated sleep could be equated with normal sleep and that when or how much you sleep didn't matter. She soon learned that the need for sleep is biological. Adults need to get 7 to 9 hours of sleep at night, sleep quality matters, and the timing of sleep matters as well. Another student testified that by taking the course, he learned more about REM and non-REM sleep. While there are misconceptions on when dreaming takes place, the course allowed him to discover that the most intense dreams usually happen during REM sleep, but dreaming can occur during any sleep stage. Other misconceptions students mentioned that they had before taking the course include the belief that being able to fall asleep anywhere means you're a good sleeper. This, in fact, may be a sign of having a sleep disorder. Napping is a good substitute for not sleeping at night. In actuality, naps cannot substitute for quality sleep at night since you aren't able to move through the different stages of sleep. It's best to nap for only 30 minutes. And sleeping with the light on during the day is harmless. But in fact, this can have negative effects on your circadian rhythms. While these students are demonstrating in an attempt to safeguard a course that is important to continuing to inform the Stanford community about all things related to sleep, our channel wants to provide viewers at home with recommendations that encourage healthy sleep habits. These include avoiding napping during the day, avoiding stimulants such as caffeine, nicotine, and alcohol close to bedtime, exercising to promote good sleep health. Eating food can be disruptive right before sleep, so do it earlier in the night. Establishing a regular bedtime routine will help with relaxing before going to sleep, and associating your bed with sleep. Reporting live, Cassia Ferguson, S&D News. Back to you, Kennedy.
Thank you, Cassia. We're going to close out this segment here today with a conversation on sleep debt and the reasons behind the drowsiness is red alert movement. When a person does not have sufficient sleep, they are in sleep debt. Partial sleep deprivation is a limited sleep over a period of several days or even weeks. Total sleep deprivation occurs when a person is awake for a minimum of 24 hours. Sleep deprivation is highly correlated with athletic performance. When you don't get good sleep, you become irritable and inattentive. Studies show that the effect on performance of even a moderate level of fatigue is equivalent to or greater than what is considered acceptable for alcohol intoxication. The drowsiness is red alert movement is a movement about safety. The most common cause of death in our age group is car accidents and people falling asleep at the wheel. Lack of sleep is dangerous for everyone, from truck drivers to nuclear scientists to news reporters to college students. 1 out of 5 motor crashes is associated with sleep-related impairment. One sleepless night can impair driving abilities as much as a blood alcohol level of 1%. There's the same number of drowsy driving crashes as drug and alcohol-related crashes combined. So please, stay safe, stay classy, and get a good night's sleep. Thank you.